All right, you may see a pop-up on your screen if you can just accept that for us. And we will, if you can stick around to the end, we would love to do a picture with everyone, you know, the Brady Bunch style photos with everybody raising their L. So if you can stick around to the end, we'll do one of those. But with that, I think that's all of the reminders. Unless anyone else from the planning group can think of anything else, we'll go ahead and turn it over to our students.
Hey guys, I just wanted to say thank you so much for tuning in today. I'm Arushi. Me and Jason are going to be hosting this panel that we have with Congressman Yarmuth. So I'm the president of the Kentucky Public Health Association here at the University of Louisville. And what our club aims to do is just promote public health and educate our peers on campus through events about public health. So just a reminder, make sure if you have a question for Congressman Yarmuth, just direct message me, Arushi Gupta, and I will be sure to ask that to him. Jason, do you want to go ahead and introduce yourself?
Hi, everybody. My name is Jason Deakins. I'm really excited for the panel tonight, but I am the current president for the Public Health Council for the Senate, for the entire school. But for our council, one of the things that we wanted to do this year was truly get some public health work done. And with that, that's talking to different system level leaders. So we're really excited to work with Arushi and KPHA to get this panel planned. It's all Arushi. She's been awesome this whole time, but I'm here to help. And so I'm a current PhD candidate for the school. So yeah, I'm really excited, guys.
Awesome. And if I forgot to add, I'm a current sophomore undergrad at the University of Louisville. And just before we begin, Dean Blakely is going to just introduce Congressman Yarmuth formally.
Well, welcome, everyone. It's always fun to introduce somebody that doesn't need to be introduced. So I'll just make a limited number of comments because I'm sure everybody knows a great deal about our congressman. So John Yarmuth represents Kentucky's 3rd district in the U.S. House. He's now in his 8th term, where he's served as chairman of the House Budget Committee since 2017, a really significant assignment. Congressman Yarmuth has been recognized for his work to improve education, expand access to affordable health care, and revitalize manufacturing in Louisville, among many other things. He was born and raised in Louisville, graduated from Atherton High School and Yale University. He and his wife, Kathy, have one son, Aaron, who many of you may know is the owner and editor of the local Leo Weekly. We're fortunate to have a representative that both supports long-term educational reforms and aggressively pushes healthcare as a human right, advocates for Medicare for all, and is a signatory on the original ACA legislation in 2010. We're now helping him appreciate the preventive public health piece of the puzzle as well. I would like to note that this is the first time in my life that I've voted on 4 successive occasions for a congressman that actually won each time. Yay. Congressman, we invited you to join us today and talk about the implications of the new administration for public health in America. Given all that's been going on the last 2 weeks or the last 4 years, or whatever you want to use as a time reference, you may want to broaden your introductory comments a little bit, but we thought we'd give you 10 or 15 minutes to make some opening comments, and then we look forward to chatting with you. Welcome, sir.
Looks like there's a technical difficulty. Marianne, can you fix that potentially?
I am working on it. Oh, I see. It looks like we have 2 folks in here with the name of John Yarmuth, so I'm making both of you co-hosts right now. Okay, try again, Congressman.
Good. Okay, I think I got it.
Sorry about that.
Well, thanks to all of you. Thanks for having me. Craig, good to be with you once again on what is an historical day and certainly an historical week in terms of the federal government and I guess the country as well. As most of you probably know by now, we voted about an hour and a half ago to impeach President Trump for the second time. This time for inciting an insurrection last Wednesday. And while he will not be removed from office before he otherwise would leave office, I think it was a very important thing to do because in my opinion, and I'd certainly be happy to discuss this with anyone who wants to, what he did last week in essentially inviting insurrectionists to come to Washington and then
John, we've frozen up.
we saw what we ended up seeing last Wednesday when 5 people were killed and many injured and hundreds, if not thousands of people traumatized by something we've never seen in our lifetime. In fact, the country has not seen since 1814 when the British actually burned down the Capitol. So this has been a very strange week for all of us up here in Washington in the Congress. I think it's safe to say that most of us have not been able to process everything we experienced and saw last Wednesday. And, but, you know, hopefully we can get past this. Next Wednesday, the new administration will be sworn in and we can hopefully try to restore some order to the government of the United States, which is critical. So it's kind of hard to focus just on a subject like healthcare when there's so many things at play right now. And I don't want a course at UofL on the Congress, American Congress. We had our first class yesterday morning, and I'm excited about doing that again. I did it last spring, and it gives me just an incredibly stimulating opportunity to have discussions with with students who bring a great deal of vitality and energy and intelligence to the class, and I'm sure this session will be the same. So let me tell you briefly where we are in terms of healthcare. I was here in 2009 and 2010 when we drafted and ultimately passed the Affordable Care Act, which was, in my opinion, the most significant piece of healthcare legislation since 1964 when Medicare was adopted. I was very proud of that. I have to tell one quick story. There was a guy who served in Congress named David Obey. David served in the House for 42 years. He was from Madison, Wisconsin. He is from Madison, Wisconsin, and was ultimately the chairman of the Appropriations Committee, which is arguably the most important committee in the Congress because it decides how the money's spent. And I was with David on the floor of the House the night that we passed that bill. And he said to me as we left the floor, you know, John, I don't know why I would ever want to come back to Congress because nothing I will ever do will be as important as what we just did. And a few months later, he announced his retirement. And I think I can say for 10 years later that in terms of policy, nothing I will ever do while I'm in Congress or have ever done will even approach the significance of that bill because that law it basically recognized, I think for the first time, that health insurance, health coverage is a right in this country and not a privilege, and that the federal government made at that time what is the most, I think the most serious and aggressive step toward achieving quality affordable healthcare for everyone. After that, we lost the control of the House, and then we lost control of the Senate. And then the next few years were spent by Republicans trying to, what they called repeal and replace the Affordable Care Act, but they actually never had a replacement plan for it. That was rhetoric, electoral rhetoric, which never could manifest itself in actual congressional action. And, I think what that showed, and I kept making this point during that time, is that there are really no options or alternatives to the Affordable Care Act except two. The two alternatives to the Affordable Care Act are one, going back to where we were before, where we had 50 million uninsured Americans, we had 800,000 healthcare cost-related bankruptcies a year. We had about 20,000 unnecessary deaths because of a lack of insurance, health insurance, and essentially a Darwinian survival of the fittest healthcare marketplace. Or we could go to single-payer healthcare, whether it's Medicare for all or some other construction of government-provided or organized healthcare and health insurance. I've been a sponsor of that, as Craig said earlier. I've been a sponsor of Medicare for all every Congress that I've been here. So now I'm in my eighth Congress, my 15th year. And I believe that ultimately we're going to end up there. But so far, because of a lot of factors, primarily, I think, the incredible amounts of vested interest and therefore money invested in political campaigns from those who are most affected by, whose profits are most affected by government action, pharmaceutical companies, hospitals, insurance companies. You can go down the list, home healthcare companies, hospice, so forth. Everybody has been fighting the kind of universal government-run healthcare system that virtually every other industrialized nation in the world has. So we have not been able to make any progress over the last few years. Now, finally, for the first time since 2010, we have a person in the White House. We have a Democratic-controlled House and a Democratic-controlled Senate, all of which are committed to the concept of expanding access to affordable, quality healthcare. And whether or not to what extent we are able to move that ball forward is still in doubt. We have a very thin majority in the House. We need 218 votes to pass anything in the House. We have 222 Democrats. That's not to say that there aren't any Republicans who might support us, but we're not counting on that. And then in the Senate, we have a 50-50 tie, and we have a tiebreaker in now, at least as of next week, in Kamala Harris. So we have the opportunity to do certain things, probably not as dramatic as we want. So the Biden administration has been very clear about what they want to do. They want to build on the Affordable Care Act. That's kind of natural because Joe Biden was vice president and worked very closely with Barack Obama to get that passed. And so that's probably the most cautious position right now. I would say that's shared to a large extent by Nancy Pelosi. I'm not sure where Chuck Schumer is. But then you have many of us, including Bernie Sanders and many others, who say, let's use this opportunity to make a moonshot. Let's try to make sure that everybody in this country has health insurance. Let's make it a government guaranteed right, and let's take it out of the for-profit capitalistic system. So that's going to be a debate that plays out over the next few months. It will play out internally in the Democratic caucuses. in the House and Senate, and in conjunction with the White House. I'm not going to predict where it will go, but again, given the small margins that we have, the partisan margins, and the unlikely possibility that we're going to get Republican support for any expansion of healthcare, I would say a dramatic shift in our healthcare legislation is not as likely as a more incremental one. So I'm going to probably stop there because I don't know where to go now with all the possible things that you may be interested in. And so probably the best thing is to say, let's respond to and have a discussion with you all. And it doesn't have to be about healthcare. It can be about anything you want to talk about, even UofL's basketball game against Wake Forest, if you want to talk about that. So I'll shut up now and respond to questions.
Thank you for your opening remarks. I think we're going to start it off and just go down to the basics and ask yourself to introduce kind of how you got into this line of work, what inspired you to do what you're doing right now.
Oh, wow. Well, it depends on how far back you want to go. So my initial interest in politics was John Kennedy's election in 1960. And I bring that up because one of the things that I have told people over the last week in terms of discussing what happened last Wednesday and my reaction to it was that my number one emotion that I felt over this last week is one of sadness. And I've described myself as being heartbroken, and I have been. And I think back to that day when John Kennedy was inaugurated in 1961, when he gave his famous speech where he said, "Ask not what your country can do for you, ask what you can do for your country." And more importantly than that, when he talked about basically a call to arms for not a call to arms, but a call to action for a new generation of Americans. And he kept referring to a new generation of Americans. And that resonated with me because I was 13 years old at the time. And I kept thinking during that event, watching him in the grandeur standing before the Capitol, that I kept saying, wow, what the world must, how great we must look to the rest of the world. And that's what I kept thinking about last week, that we don't look nearly as good to the world as we did then, and we have most of my lifetime. So, but anyway, that was my initial interest in politics. I ran for student council presidents. I was elected vice president and then president of the student council at Atherton. After I got out of college, I spent 4 years as a staffer in the U.S. Senate for a man named Marlowe Cook, who was a U.S. Senator from Kentucky, a Republican, and actually ran for office with Mitch McConnell. So I was a Republican until 1985, and I know people will find this hard to believe, but I was an ally of Mitch McConnell's, for a political ally. And we ran for office together in 1981. He won, I lost. I was a challenger, he was an incumbent. And then I pretty much gave up my interest in serving in public office or being involved in the political system. I was engaged in journalism for most of the rest of my life from then until 2006. And so I never lost my interest in public affairs. As a journalist, I covered politics and policy. I wrote, for 15 years, I wrote columns about that. But then in 2006, when a guy named Jack Conway, who some of you may remember, was a Kentucky Attorney General for 2 terms and then ran for governor and lost to Matt Bevin. But Jack had run for the 3rd district seat in 2002, barely lost. I thought he was going to run again in 2006. because at that point, George Bush had become, and the war in Iraq had become very unpopular. It was a better opportunity for a Democrat running against a Republican incumbent. And then he decided not to. And when he decided not to, I said, oh, darn, but stronger language than that. Now she's going to have another free ride, because I didn't think there was anybody out there who could challenge her. It was a woman named Ann Northup, who was the incumbent. And so I'll condense the rest of the story. I ultimately decided to challenge her, thinking that I wasn't really looking for a new career at that point. I had sold Leo. I was still writing columns, but I had a great life. I was playing all the golf I wanted to. I was doing a lot of civic and charitable work. And I was actually working about 3 hours a week, writing columns, and I did a TV show. But I said, if I can flip this seat from Republican to Democrat and be one of the 15 seats that needed to be flipped nationally to change control of the House of Representatives, then I can help put an end to the Bush agenda, the George Bush agenda. And then it won't matter whether I like the job or not, I will have done something significant. So I ran, I won. We flipped 30 seats that year, including this one. And here I am 14 years later, beginning my 8th term. I never, ever dreamed I would be in the House 10 years, more than 10 years. I said, if I ever write my book about my experience in Congress, it will be called House Arrest, because there is something about being in the House that doesn't let you go. And so I'm still here.
Absolutely.
That's as much as I can condense my career path.
That's all right. Thank you. So a good question that we have is, a lot of 2020 has been negative for a lot of folks, right? And so it's been a challenging year. So as Congressman, what can you see that you've seen as being positive for 2020? What has been maybe some benefits that's come out of the year, or?
Boy, it's hard to find any. It's been a disastrous year in so many levels. One thing that I have thought about, and I hope that once we get through most of the pandemic crisis and we return to normality, and I hope to the extent we can, I hope we focus on it this year in Congress, is, and I'll explain it anecdotally. Last summer, I was on a phone call with some labor union people, and one of the guys on the call, and there were some women as well, but one of the guys was basically he was the maintenance worker at Seneca High School, and he was talking about what he was going through with the pandemic and trying to keep the school safe and so forth. And I started thinking, his name was Greg, and so I started thinking, I said, there's probably nobody in the country who has given one moment of thought to Greg or people like him until now. So, but now Greg becomes an extremely important person, because when parents think about sending their kids back to school, they're going to worry about who's sanitizing that school, who's keeping it clean, who's protecting those kids. So Greg becomes a hugely important person. Same with the people who stock the grocery shelves, same with the people who drive the buses, same with all of these people who were doing the really difficult work at risk to keep the country functioning when it was going through the initial stages, and still to this day, but then was going through the initial stages of this disruption. And it seemed to me that it would, if anything good had come out of that, it would have been, we reevaluate how we value certain jobs. And because, I have a lot of friends who've done very well in life, and they wouldn't do Greg's job for $100 an hour, right? And they wouldn't stock grocery shelves in a pandemic situation for $50 an hour, even though that might have been more than they were making. And it's just that we as a society, and a lot of this has to do, and I don't want to inject race too directly, but A lot of this has to do with racial disparities too, because a lot of these jobs are disproportionately held by Blacks and other minorities. And so all of a sudden, these jobs where we're paying somebody $10, $11 an hour, if they're lucky, we have to say, wait a minute, these jobs are much more important than that. They're much more valuable than that. We need to compensate better, more people more effectively, or more adequately. And by the way, that helps reduce these disparities in income and wealth in the country. And so I don't see a lot, I don't hear a lot of forward discussion of that, but if anything positive comes out of 2020, I think that's what it will be. I think, you know, long term, we will be reevaluating the way we do a lot of things. I was one of those who thought that that classroom education classroom education was doomed, that was something that was going to go the way of the typewriter or so. And I've reassessed that. I think what we've seen is there kind of a reassessment of how important some kind of personal interaction is in education. So I think we'll end up seeing more of a hybrid situation going forward. The whole concept of work and whether we actually need to go to an office, or do we need to go to an office 5 days a week, or can we go to an office 2 days a week and work remotely? And how, so I think there are kind of a lot of things that have happened that will reshape how we do things and more efficiently. And maybe, you know, a lot of people say, I don't really want to be home every day because I can't take care of my kids every day and do my job. But then a lot of other people say, well, it's great to spend so much time with my family. And so, you know, hopefully we will evolve as our work environments as well in a way that makes work more pleasurable, that makes work more convenient, that makes family life better. Those are all possibilities. It could all go wrong. Sorry about the length of that answer, but.
Thank you for that answer. So you mentioned COVID-19, and COVID-19 has definitely taken over everyone's lives. So in regards to COVID-19, how have you specifically seen Louisville impacted? That can be socially, economically, education-wise. What is Louisville doing to control the spread of the virus? And do you think these efforts are good, or do you think more can be done?
Well, I think what we've seen early on in the pandemic, both Louisville and Kentucky, relatively speaking, did a really good job. And you know, we had in Louisville, even in the worst part of the spring, we had 70, 80 cases a day. In Kentucky, we had 200 cases a day. Now in Kentucky, we have 4,000 cases a day. In Louisville, we have 700 or 800 cases a day. What we were doing a good job, and then people just decided that they were, I think, two things. One, that they were willing to assume the risk of getting sick in order to have a more normal lifestyle. And secondly, we had a number of public officials who basically cast so much doubt on how serious the crisis was that people just let their guard down and said, well, it's okay. I mean, there's still people out there who say it's a hoax and it's not serious. And yeah, I can go to a bar without a mask and I don't need to wear a mask. And, you know, we're still fighting with, we're fighting with people in Congress, elected representatives who refused to wear masks. If you saw the news, we had a situation last Wednesday where hundreds of people were evacuated to one big hearing room. And I hate to sound partisan, but it was totally partisan. The Republicans a lot of them refused to wear masks in this room where people were in there tight together. And already we found three Democratic members of Congress have contracted the virus just from being in that room. And that was after Democrats pleading with these Republicans to put masks on, and they wouldn't do it. So Part of it is it became a political issue, which is bizarre, but it became a partisan political issue. And that has prevented us from, I think, controlling it better than we have. And then the other part of it was just human nature. And, it's a shame because the first part of your question is, who does it affect? There's nobody who is not affected by it. And obviously school education's been affected. Healthcare has been extremely affected. We have overcrowding of hospitals all over the country, crisis levels, and we have healthcare providers who are exhausted, worn out, frustrated, and certainly in terms of locally, our what had been probably our most dynamic part of the economy, which was bourbonism, tourism connected to bourbon, and our new convention center and hotels and how many people we had booked in here, and all of that incredible progress was just a dead stop now for 10 months, and so the hospitality sector has been dramatically affected again in Kentucky, and there are a few businesses that have benefited by it, but for the most part, everybody has been adversely affected by the virus. And hopefully now that we have a vaccine, and the vaccine I think is going to be rolled out at a much faster pace over the next couple of months. And the more and more people we get vaccinated, the sooner we can get back to some kind of normalcy. And but it's pointed out a lot of flaws in our healthcare system. And again, what we've seen is, again, a disproportionate adverse effect on Blacks and other non-white population for a variety of reasons. And you get the disparities in access to healthcare have been dramatically illustrated. And that's why I think that, whatever we do in Congress over the next few months or the next year in terms of healthcare, that's one of the things is going to drive it, is that this recognition that it's not just money, that there are all sorts of factors that have led to this disparity in healthcare between and among ethnic groups and races, and we've got to end that. We got to fix that.
Absolutely. I think we'll stay along with the COVID-19, and it's a big thing, still is. So one of the questions we got from the audience was, one of the issues we discovered this last 4 years is that the public health infrastructure in the Obama administration was completely ignored in the Trump administration. So what is likely to be done post-COVID-19 to ensure that a greater investment is going to be in the formal public health infrastructure?
One of the great aspects of the ACA, in my opinion, was that we did invest a lot more money in community health services and community health facilities. And we saw it here, the investments that were made at Park Duval and in the other community health centers we have here in the community. Literally tens of millions of dollars went into those centers and provided for care. And the number of people who were able to access care in those areas was dramatically increased. And that was a hugely positive aspect of the ACA. That's been, let me put it this way, that has not been enhanced over the last 8 years anyway. And we're committed to embellishing that, because there's so many. I mean, in Louisville, I think the number is close to 50,000 people essentially get all of their healthcare through community health centers. That's a huge percentage of the population, and it's affordable and it's quality and it's available. The one challenge, well, there are many challenges. I think the biggest challenge we're going to have going forward is that no matter how much money we throw at healthcare, and in terms of the access side, so we can give everybody all the benefits we want and all the insurance we want, but if they aren't able to access the care, it doesn't matter whether they can pay for it or not if it's not there. So I think what we're going to have to focus on the provider community, which means, for instance, creating more residency spots, creating more, widening the pipeline through med school and through the residency programs and so forth, because we have a huge percentage of our medical providers are going to be retiring or are retiring right now, and are going to be retiring over the next 10 years or so. So we've got to fill that gap. And right now there's kind of a bottleneck, and we need to, part of that can be done by immigration if we reform our immigration laws appropriately. And I think we need to do that. But again, we've got to do these residency programs and expand access to those and funding of those. So, it's like, one of the plans, the Medicare for All plans that's before Congress right now, is one that provides long-term care, skilled nursing facilities, whatever it may be, as part of the benefits. Well, we can give people long-term care benefits from the government, but if there are not enough skilled nursing facilities and assisted care facilities and so forth, then that doesn't matter. If you give them the benefit, but they don't have anywhere to use it, it's worthless. So we've got to think about that side of it as well, is that we want to provide the benefits, but we also have to provide the care, make sure that there's enough care available. And we've got a significantly aging population. 10,000 people a day turn 65 in the United States, and we've got to worry about home health care and community-based services and so forth. All of those things that will serve those people who are older and need help of varying degrees. And one of the positive things that's happening now is that technology is filling some of those gaps. So we now have telemedicine that is really helping in a lot of areas. So doctors can see patients without visiting them. It's much more efficient, and it eliminates the need for, in many cases, people who can't travel very easily to get care and medical attention without leaving their homes and making tough trips. So I think you're going to see technology continue to play a bigger and bigger role in medicine, and that's something that, as a government, we need to encourage. And so then you start thinking, well, what about in rural areas where they don't have broadband? And you got to make sure that everybody in those areas has access to that so they can use telemedicine. So it plays out across a number of disciplines, and it's pretty complicated. But again, I think at least we've had hearings in my committee, and even the Republicans talk about telemedicine and how important it is, because Republicans tend to represent more rural districts and small town districts, and Democrats tend to represent more urban districts. So they recognize the importance of this too. So those are some areas where we can probably get some bipartisan cooperation in extending care to more remote areas through technology and government investment. So again, it's a huge challenge. You're talking about, with healthcare, you're talking about 20% of the economy essentially, and that's no small task.
So just going off of that, we had a question from the audience. So the Obama administration had developed a formal public health strategic plan for what to do once a pandemic would occur. That document was ignored by the Trump administration. What can be done to help better establish that public health infrastructure and ensure that we are better prepared next time?
Well, I think what you'll see with the Biden administration, because Biden was part of the Obama administration and he was part of that effort. And I think he and the people he has appointed to key positions are very much committed to make sure that we're much better prepared. I know he is very frustrated at the way that the Trump administration handled the pandemic, the way they basically ignored science, that they thought they knew what they were doing. And most importantly, they minimized the responsibility of the federal government to be leaders in combating the pandemic. And that's kind of a philosophical perspective, where you have a lot of Republicans who say, okay, the federal government has very limited roles. The federal government's role should be creating an army and a military and defending our country, and then on everything else, get out of the way. And that's simplifying it a little bit, but it's not far off. And that's where I think the people Trump brought into his administration, who were not really government oriented, they were mostly private sector oriented. Just for an example, he brought in Mr. Azar as Secretary of Health and Human Services, who was a pharmaceutical lobbyist and pharmaceutical executive. So he resisted any effort for the federal government to play a leadership role in dealing with drug prices or anything else, drug supply. And of course, we saw a lot of that with the preparation for personal PPE and other things at the outset of the pandemic, where the supplies that were built up over the previous administrations had been decimated, and there was no reserve of equipment, that personal protective equipment or otherwise, ventilators. And then after that shortfall was illuminated, they basically said, well, we're not going to use the power we have as a federal government to mobilize the private sector to get that corrected. And so there's a philosophical underpinning to the response that the Trump administration gave to the pandemic, and it's very different than the philosophical orientation of the Biden administration. So I think you'll see a very different level of response in all of these areas from the Biden team.
Beyond the Medicare for All, what changes would you like to see to the Affordable Care Act? And secondly, given the traumatic events of last Wednesday, how are you and your colleagues doing or coping mentally?
Well, boy, two very different questions. I think with the Affordable Care Act, there were definitely flaws in the Affordable Care Act. I think what we tried to do was create an incentive for people to become insured, and then gave federal subsidies to make the insurance affordable. We did very little, or certainly not enough, to control the costs of the care. So while the government was subsidizing a lot of the cost of insurance for many people, the cost kept going up, and it still made it very difficult for a lot of people. So we've got to do a much better job of dealing with costs, prescription drugs being number one. And I just had I don't want to call it a scare, but I had a little incident where I had to go to the hospital and to see if there was any reason for me to be afraid of whatever was going on. And I was in the hospital, I was in the emergency room for about 3 hours, I guess. And my bill, I have great insurance, but my bill was over $7,000. And that was for basically just routine testings and screenings. It turned out there was nothing at all to be worried about. Nothing happened, but that the reason they can do that is because of healthcare and health insurance, and with no controls on it. And I hate, I know a lot of people resist government control of the private sector, but you can't have, healthcare is not something that can be dealt with in a purely capitalistic context, because capitalism requires kind of relatively equal power from the buyer and the seller. And in healthcare, there is no relatively equal power. The seller has all the power. The provider of the services has all the power. The buyer is sick or hurt or injured. And so there's no negotiating, there's no leverage that the customer has. And that's something that I think only the government can control. And that's why I think we're the only country in the industrialized world that doesn't have a government organized system, because we let the private sector control the pricing. And except through Medicare, we control the pricing on Medicare fairly well. And but the problem with that is the providers. So you have hospitals, you have doctors, you have all these other providers. You have a variety of providers, but I mean, you have one universe of providers, but they have many different payers. So you have Medicare, you have private insurance, you have TRICARE, which is medical, the military, and then you have and Medicare, and so forth. So if one of your providers keeps a ceiling on your costs, tells you that they're only going to pay so much, what do? You raise the price on everybody else you can raise the price on, where they're uncontrolled. And that's what happens in our system. So when the government tries to control costs, then the private sector gets charged more, and that means private insurance or people who are paying on their own. And so they're making up for the Medicare patients or the Medicaid patients, and it gets totally out of whack. And that's why most countries have decided we will control all the prices in one way or another through a centralized system. And that's why I think ultimately we have to have that. And I've talked to an awful lot of people over the last 11 or 12 years dealing with healthcare, and most everybody, even huge corporate executives, say we've got to go to single payer healthcare. We have to go to Medicare for all, because we can't continue to do that because your employer is the one across the entire economy. Companies are the ones who are paying the most money, because they're the ones, that's the largest portion of the private insurance market, and that they're the ones who keep bearing the burden of the increased cost. And so anyway, that's that. Now, as to how we're dealing with last week, I actually wrote a piece for that was published in Leo Online, in Leo Weekly. You check it out. And in that piece, I said, I like all people, we all have defense mechanisms to deal with adversity. And my defense mechanism was, I've always been really good in a tense situation or a crisis situation of using my brain to put things into perspective and try to contextualize them and think through them intellectually so that I don't have to let my emotions run free. I have been totally defenseless in that regard since last week. I've not been able to process intellectually what happened last week. And every day since Wednesday was bad. Every day, and I was not personally at risk. I was in my office, but I never feared for my own safety, because my office isn't in the Capitol. The action was in the Capitol. I'm on the 4th floor of a building, and they weren't going to come for me. But I was afraid for my colleagues who were there, and for the media who were there, and for everybody else who was in harm's way. But every day since then has been worse, because I've learned more about what went on, and the fact that, you know, you saw a video of one person beating a Capitol police officer with an American flag. You saw the video of people running through the Capitol with Confederate flags. You heard news coverage of people defecating and urinating in the Capitol. The depravity of what we saw and what we continue to see, and the brazenness of many of these people, almost the suicidal nature of some of them, the fact that some of them, you know, they taking selfies of themselves committing crimes and putting them out. It's again something that I haven't been able to process, and I don't think my colleagues have been able to do that either. And I've talked to a lot of them, some who were actually in the gallery of the House at the time and had to evacuate with gas masks on, and some who had to sit in the darkness for 4 hours under a table. You know, I think we've all reacted more emotionally than we have intellectually, because there's no way to figure out what's in the hearts and minds of these people. You know, couple of columnists I read, or commentators said, we don't really need to try to understand these people. We need to deprogram them. And their point was, these people are in a cult like mentality, and that, you know, that seems right, but again, it's going to take me and I think a lot of my colleagues a long time to try to put this in some kind of meaningful perspective, because right now it just probably for the first time in my life, I viewed total insanity, and that's hard to get your head wrapped around. And seemingly normal people, you know, again, this is what's come out since then. So you get a Toyota salesman from Baltimore who comes down and gets involved in this. You get a real estate broker, a woman real estate broker from Texas, who flies her private plane to Washington. So she's obviously doing very well, and she gets involved in this assault on democracy. You get this woman, an Air Force veteran from California, who flies all the way here and ends up getting shot to death. And so it's not like these are all militia types. The militia types were there, and those people, you know, I don't really understand what drives them, but I get them a lot more than I get a lot of these other people who, again, seem to be normal people who have developed such rage, fury, and delusion, because the idea that they were ever going to stop Joe Biden from being inaugurated president is delusional. So anyway, that's as raw and as candid as I can describe what I've been going through over the last week.
Thank you so much for sharing that. So just changing gears a little bit, what is
I'm
your
drinking a lot of bourbon too, so.
What is your advice for working mothers with school-age children who do not have access or cannot afford childcare or FMLA?
Well, giving advice like that, I can tell you how we need to respond to that situation. I can't give advice to those. You know, I have a son and daughter-in-law and a 17-month-old grandson. But they've got all the resources in the world. My daughter-in-law runs a daycare center in Crestwood. And so she's got all the care she needs. But what we need to do as a country, we are so far behind the rest of the world in this respect. And, part of it is definitely at the federal level mandating family medical leave. That's elementary. That's no brainer. And we need to do that. We need to provide subsidies for people to be able to afford childcare. And then we have to, in some ways, subsidize the childcare operations because, right now, these are not high profit operations. And unless the government helps to subsidize them, the costs become prohibitive for the families who need to use them. The other thing I think we need to do, and this is one of my real passions, is we need to create universal preschool education starting at 2.5 years old. For a variety of reasons, but one of those kind of ancillary reasons is that if we do that, then we've solved the child care problem for a lot of families. If their kids are in educational programs all day at 2.5 years old, then we've taken care of their child care problem. We've also created a much firmer foundation for them educationally. Europe does this right now. In most countries in Europe, there is universal all-day education and it's not just babysitting. This is education for the kids starting at 2.5 or 3 years old, and we need to do that in this country. And to the extent that the federal government needs to help pay for that, we need to pay for that. And I say that for all the reasons I've mentioned, but also for this reason, that this country is changing demographically very rapidly. And what we're seeing now is that we have a huge percentage of our young people, our children, are those coming from the lower income segments of the population. So they're in lower resourced households. But 20 and 30 years from now, they're going to be the majority of our tax base. So if we don't make sure that they have the strongest possible foundation educationally and are able to go on with productive lives and successful lives, then the overall society, the economy is going to suffer dramatically. So again, there's a humane aspect to that, or I shouldn't say humanitarian aspect to that, because these kids deserve the best possible chance to succeed in life. But there's also an economic reason and kind of a sociological reason in terms of providing childcare. That is, I think, important policy. And I don't know if you have the opportunity to do it, but there's a place called the Keystone Academy, and it's on South 15th Street in Louisville, right in the middle of some housing projects. Most of the kids in this program most of them are Black. But if you went in there and just spent an hour watching these kids, and the kids are there from infant to I think 8, but most of them are gone by 6. What they do with these kids is the most remarkable thing I've ever seen. And again, these kids all come from lower income households, but their social skills, their verbal skills, their ability to work with each other and express themselves creatively is off the charts. And the whole theory behind it is that, and it's something called the Reggio system. It came out of Italy. And it's basically that the kids decide what they want to learn and what they want to do. The teachers are facilitators. They're not teachers. And I will tell you that it's miraculous. It is miraculous. And these kids end up with such a huge head start of of other kids, their contemporaries, when they actually go into the school system. So it's like, why can't every kid in this country have access to that? So again, I think that's something that we really need to challenge ourselves as a society to get done, because it is our future.
Absolutely, and you already touched on it, Congressman, but a little bit further and deep into it. Racism is referred to and has recently been deemed as a public health issue, emerging public health issue. What are your thoughts on what has transpired in our world today in 2020 and over years, and how do you feel we can move forward to end racism?
Well, I've had many conversations about this topic, and ultimately we will breed our way out of it. Ultimately, we will breed our way out of it. 2 or 3 generations from now, there'll be no majority race. Everybody will be mixed race, but in the meantime, we got some serious problems. And they manifest themselves in policing, and housing, and education, and healthcare, virtually every way you can think. There is a racial disparity in virtually every area of American life. And for those who think there is not systemic racism in this country, those people are just not paying attention. And we see it in all sorts of ways. Again, this is kind of anecdotal, but it's significant to me. So I was very fortunate to go to Yale. I was kind of an affirmative action admission to Yale. I was a public school Midwestern kid at a time when the universities were overwhelmingly Eastern New England and prep school. So they wanted to diversify. So that was their idea of diversification at the time. they took a guy from Louisville, Kentucky, who went to public school. But my impression of years later, like maybe 10, 15 years ago, was that Yale had been a fairly diverse place. And I thought that because 3 or 4 of my really good buddies at Yale were Black guys. And but I decided to review the stakes. And I went back and got my freshman yearbook out. And I started looking through all the freshmen, their photographs. And to the extent that you could tell by a photograph, there were 10 Black, we were all male at the time, 10 Black guys out of 1,000 guys in the freshman class. And that stunned me. And I started thinking about, how Yale regenerates itself. It did at the time. And you had, alumni, you had this crazy prep school preference, you had preferences for sons of alumni. If you were son of an alumni, you could be 30% less qualified than somebody else and still get into Yale. And all of these kind of structural elements were prohibiting or were excluding diverse population in Yale, and that continued. And it's probably not very true right now, but it did for years. And Yale was created and founded in 1701. So for literally centuries, there was this systematic exclusion of people other than the people who were like the ones who founded it. And so when you think about systemic racism, most people, so you look at Yale right now, and Yale is probably, I don't know what the Black percentage is, but it's probably 35% Asian. White students are in the minority. White males are definitely in the minority now. But again, that's very, very recent. But you think about all the ways that that kind of systemic exclusion, which was not necessarily, it wasn't necessarily racist. Some of it was just kind of inertia, but it ended up with a racist result. And then you have the more overtly racist things like policing, the difference there, sentencing for certain, we have it in housing as well. You had redlining, and so that blacks were not allowed to buy homes in certain areas, and banks wouldn't finance them in certain, wouldn't finance black owners in certain areas. And in education, we know that not just the admissions to colleges, but also the resources that went into white schools versus predominantly minority schools. One after another, again, across society, you've seen this systemic racism. Now, how do we end it? We end it partially by government action. I don't think we can avoid that. I think we have to do it. We should do it. We're going to have a much more serious debate during this next Congress, I think, about reparations. And that will be an interesting debate to have, something the country needs to have. But, and I think the Biden administration is really, that's one of their priorities, is to see what the government can do to at least eliminate or minimize the structural disadvantages, and what we can do to raise up everyone in the country. So, a $15 minimum wage, easy. So you provide a $15 minimum wage, and all of a sudden a two-person family is now a $60-something thousand annual income family. That would be a huge advance. So you've got things you can do that automatically start to change the disparities and minimize or reduce the disparities. But then some of the structural things, like I think, for instance, that if I were a czar right now, and I don't know whether the Biden administration is going to do this, but I would create a fund and I would put it in somewhere in the $200 billion range. That would be my guess, a $200 billion fund to finance minority-owned businesses. And so if you want to start a restaurant and you're a Black American and you need $50,000 to start your restaurant, this fund would be to give you the starting money, initial funding. I think we can and should do that type of thing to begin to use the government's ability to spend money to finance wealth building opportunities for Black Americans and other minorities who have been discriminated against, but primarily Black Americans. The other thing is going to take time. I mean, we saw it last week. We saw the racial and anti-Semitic and I mean, these were white supremacists who were doing this. They ran that attack they orchestrated that attack on the Capitol, and with the Confederate flag, and there were people wearing anti-Semitic T-shirts, and so you're not going to change those people. Those people are gone. You're not going to convince them that their worldview is wrong and that they need to change it. So hearts and minds are very different than kind of structural things. We can, as a government, we can deal with structural things. We can't deal with hearts and minds. But I think that's going to be, again, a generational thing. I think once my generation passes from the scene, it's going to be it's going to be 70% better. And then when the next generation passes the scene, it's going to be non-existent. Because your generation and even my son's generation, he's a millennial, my son's generation, race is the last thing they think about. It's just not even an issue. And so through genetics, we'll breed our way out, because we'll intermarry, we'll reproduce, society will, and then again, the right people will pass off the scene, and racism will be gone. But again, I don't think there's anything you can do to change a racist mind. I just don't. I wish there were. Well, we saw it last week. What in the hell is Robert Stivers, the head of the Senate in Kentucky? He's crying on the floor of the Senate in Frankfurt, because the UK basketball players knelt for the national anthem. Seriously? And a guy beats a Capitol policeman with an American flag, and he's claiming that those black basketball players are disrespecting the flag, when this guy is beating a law enforcement officer with a flag, and that's not disrespecting the flag? What the hell's he thinking? You're not going to change that mind. Again, I wish you could.
Thank you for that response. So just changing gears a little bit, how worried are you personally about the makeup of the Supreme Court?
I'll give you a surprising answer. I'm not all that worried about it. I think I say it for two reasons. One is that I know that Gorsuch and Kavanaugh and what's the latest one name? What's her name? Can't remember her name now. The latest justice they have relatively conservative outlooks and backgrounds. On the other hand, they live in this country. They live in the world. They feel where society is going to. I really have come to believe that John Roberts, for all of the commentary about him as being a strict constructionist and so forth, an originalist, has become a very political Chief Justice. Political in the sense that he understands that so much of what the court deals with are political issues, and that in order to be credible as an institution, that court cannot be seen to be responsive to the Republican Party. And so I think he's been a very moderating influence there. And I think what you're going to see over time is that these justices, in certain areas, I mean, I should qualify. There's certain areas that I am fearful of. I mean, abortion rights, I think, is one of those areas where, anybody who's pro-choice needs to be concerned about this court. I think if I were a union person, a labor union person, I would be concerned about this court. I don't think there are many issues that are going to come to the court involving labor unions' rights, and if they do, I think Congress can deal with those. But for the most part, I think they're not my. I would much rather have Merrick Garland. I'd much rather have a lot of other people on the court rather than the last three who were seated. But I'm not overly scared about it. Again, primarily because of John Roberts, and also because I think these men and women, the ones who've just appointed, are young enough that they're gonna have a better handle on where society's going, and I don't think they're gonna want to get too far behind society, behind where the country is. Because the country, everybody says the country's center right. I don't think that's true. You pull on them at almost every issue in this, and the country is pretty much center left or left. And I think, again, those justices are not, they're young enough to get that. So I may be totally Pollyannish about this. Maybe I may be totally wrong, but I'm not scared of this court. And they've shown in the last, particularly with the electoral stuff, they've shown that they stood up to Trump. They put down all these crazy cases, and I don't like what's happened in capital punishment. They seem to be willing to let these people be executed, and we've executed more. And the people we executed, a first woman, God, I think in almost a century, just yesterday at the federal level, and they wouldn't stop that. So that's kind of disappointing. But overall, I'm not petrified about the court, but I'm always going to be anxious. I'd rather have the court before Ruth Bader Ginsburg left it, for sure. And Kennedy.
Okay, absolutely. So I just to wrap up, because we only have a few more minutes to go, but I have two questions, one from the audience and then one to wrap up. So from the audience, what is the process to eliminating noise pollution, specifically excessive train horns within underserved and predominantly minority neighborhoods like the West End? And then the second question to wrap up is, can you give suggestions or advice to UofL in terms of supporting Black, Indigenous persons of color and making it more diverse and inclusive institution?
Okay, well, on the first question, I have no idea. I mean, that's not my jurisdiction. I leave that up to the mayor and the Metro Council, and it's just not something I've thought about or dealt with. And I think everybody has a fundamental right to have a fundamental right to privacy, and noise pollution is an invasion of privacy. It's the way I look at it. So I think ordinances are perfectly appropriate, and if our city ordinance is not adequate, we ought to review that. And then as to UofL, I'd just let Ricky Jones run everything, actually. Ricky's a good friend of mine, and I assume everybody knows he's head of the Pan-African Studies department there, and columnist for the Courier Journal. I was the first person in Louisville to ever publish Ricky Jones when he was at Leo. When I was at Leo, and I encouraged him to write, and so I know he will agree that his career as an author, published author, was due to me, at least initially. But I think you've got a president right now. Neely is. I think she has all the right instincts, and I would. I wish I were more familiar with what's going on at UofL in that regard, other than what I read from Ricky. And Ricky had has had his own struggles with the administration, which he appears to have won. But I actually worked at UofL for 3 years back in the 80s. I was an assistant vice president for university relations, and so I have a sense of what the mission of the university is, and I always understood and applauded the urban mission. And as far as I can tell, UofL has done a really good job of creating opportunities and creating access for Black students and going into the community and providing services and working with JCTC and Simmons and to create pathways into U of L for minority students. In terms of the administration and faculty, that's an area that I really am not knowledgeable enough about to talk about. And that may be what you were referring to, Jason, I don't know, but that's something I just don't have enough information on. But I know the urban mission has always been part of U of L. I was always very proud of the fact that, even though it sounds bad, but when I was working there, the average student took 7 years to get through U of L. And while that's really, in one respect, you say, well, that's terrible. But on the other hand, you say, wow, what great people are persevering and work, because everybody at U of L is working. Most everybody's working their way through school. And, I think U of L's done. I know they're working hard to make sure that minority students do well and are retained and are given the support they need. If it's not enough, then I think speak out. But again, on the faculty administrative side, that's something I'm just not competent to talk about.
Well, those are the questions we had for the panel today. I wanted to thank you on behalf of, everyone at U of L and especially the School of Public Health for coming and speaking to us about your experience and just the intersection of politics and public health. So thank you so much, Congressman Yarmuth. And I think Dean Blakely is going to do a little bit of a wrap up, and then we will be taking a group picture at the end. So thank you.
Okay. All right. You're welcome.
Well, John, you may remember a little over 2 years ago, you had you were at a gathering at Muhammad Babar's house in preparation for your previous term when you were running. And we asked you a question then about this presidential election a couple of years ago. And you very confidently stated that if the president did not decide he didn't want to do this game anymore because it was too much work, or if he wasn't removed from office and he was running again, that there's no doubt in your mind that Joe Biden was going to be the candidate and he would win. So I have one last question. If you're that good at making predictions like that, do you happen to have a good set of 6 numbers between 1 and 54?
No, but I saw a question flash up. What's my favorite bourbon? And I can't answer that one. So I answer that 2 ways, because for those who don't know, I am the founder and co-chair of the Congressional Bourbon Caucus, which is a very popular, very active, and very bipartisan caucus in Congress. And so I'm asked that often, and I say my go-to bourbon, just kind of my default bourbon, walk into a bar, is Woodford Reserve or Buffalo Trace. Those are the 2. But then I say, if I had one drink of bourbon left in my life, what would it be? And that's Elijah Craig 23-year-old. And when 4 years ago, when I did not attend the inauguration of Donald Trump, I was sitting at home and with my wife watching, and it was 5 minutes to 12. And I said, we need to toast the last minutes of the Obama administration. So we opened a bottle of Elijah Craig 23-year-old. And even though it was before noon, we toasted the Obama administration with Elijah Craig 23-year-old. So that is how I would say that is my absolute favorite bourbon.
So have you had any Uncle Nearest?
Uncle Nearest? No, I've not heard of it.
Yeah, that's a historic original African-American bourbon maker from which most of these Johnny-come-lately folks learned how to do it. Check it out.
I'll check it out. Absolutely.
Yeah.
I will do that.
All right. Well, let me also say thank you so much for joining with us. Mary Ann, go ahead and get ready on what you want to do on trying to get a picture. We know that you are extremely busy just by feeling what's going on every day. And I've had the opportunity to ride back and forth to DC on planes next to you and others before. And I always see the stack of stuff in your lap that you have to deal with. So thank you so much for what you're doing for us every day. Thank you for representing Louisville. And in fact, the whole state. You're the only one that really represents many of us very well. But we
Thanks
really
for saying it.
taking time to share with students. I hope you've got your bourbon ready to celebrate the day's event. And
Well, I've done that, yeah. Now the cards play at 8:30, so I'll be
good to go.
focusing on that, and then getting up early for my 8 o'clock class with Jasmine Ferrier tomorrow morning.
Our new development officer. Yes.
Yeah, new advancement, right?
All right. And Dana, and thanks to you and your team for helping us pull this together. Arushi and Jason, great job. Mary Ann, thank you for infrastructure support. Really appreciate it. So Mary Ann, you got instructions for us. Go ahead.
I do have instructions for you, and I'm happy to help anytime, Dean Blakely. This is a great event. As a poli-sci grad, I really enjoyed this. I'm jealous of those in Jasmine's class tomorrow morning. I am very jealous of them. So anyone who wants to turn on your video now, just to be a part of the photo, if you would go ahead and turn your video on. And if it makes anyone more comfortable, I'm going to go ahead and stop the recording.